Let's keep going. Last week, advocates and sane human beings celebrated the 50th anniversary of Medicare, which has, by the way, saved the lives and loves of countless human beings since its inception. Activists also held a rally in D.C. calling for the expansion of Medicare. Act.tv was there, and I have some footage for you. But first, I have a message from the man who really hammered away in his last two presidential runs on how badly we need Medicare for all. Here is a statement from Senator Bernie Sanders.
56 years ago today, President Lyndon B. Johnson signed Medicare, one of the most popular and successful government programs in our nation's history, into law. Before the enactment of Medicare, as you all know, about half of our senior citizens were uninsured and roughly 35% lived in poverty. Today, everyone in America aged 65 or older is guaranteed health care benefits through Medicare, regardless of income or medical condition, while the official poverty rate for seniors is now less than 9%. The program now covers more than 62 million Americans, and 9 in 10 beneficiaries say they are satisfied with their health care. That is the very good news. But there are also gaping holes in Medicare coverage. 75% of senior citizens who suffer from hearing loss do not have a hearing aid because of the prohibitive cost. 65% of seniors have no dental insurance and no idea how they will be able to afford to go to a dentist. More than a quarter of senior citizens in this country are missing all of their natural teeth, with many unable to properly digest the food they eat, and over 70% of Americans 65 and older have untreated gum disease. Most shockingly, recent studies found a sharp increase in cancer diagnoses at 65. Why? Because too many Americans are waiting to get their Medicare coverage before seeing a doctor. That is why progressives are fighting so hard to expand Medicare in the coming budget reconciliation bill. We want to guarantee vision, hearing, and dental coverage, and we want to lower the eligibility age to 60, which would give 23 million older workers the security of knowing they can finally address illnesses and injuries and not worry about how they will pay for a doctor. And we're going to pay for it by taking on the greed of the pharmaceutical industry and finally allowing Medicare to negotiate prescription drug prices. It is time to end the international disgrace of Americans paying the highest prices in the world, by far, for prescription drugs. The time is now, more than 50 years later, to fully realize the vision of what Medicare is supposed to be about. Let's work together. Let's get it done. Thank you.
I felt the burn, as usual. Also sending in a statement was U.S. Representative Pramila Jayapal from Washington, who, along with Debbie Dingell of Michigan, introduced the Medicare For All Act of 2021. Now, this is transformative legislation that would guarantee health care to everyone in America as a human right. I think we should be doing this, especially at a moment in which nearly 1 million people are either uninsured or underinsured during a global pandemic. Finally, the people care about this. You have to threaten them with a pandemic in order to get people to actually want other people to have coverage. But hey, we're working toward that. Here is the video of Representative Jayapal.
Hi, I'm Congresswoman Pramila Jayapal and honored to represent Washington's 7th Congressional District in the House of Representatives, where I also serve as the chair of the Congressional Progressive Caucus. Thank you so much for inviting me to join you today as we say happy birthday to Medicare. Medicare is one of the most popular and foundational programs in our nation's history. Since its inception in 1965, it has not only provided coverage, but also reassurance to millions of older Americans. And as we emerge from the COVID-19 pandemic, this is a historic opportunity to build on Medicare. to make a critical expansion of Medicare that will guarantee health care for millions of older adults struggling with the health and economic realities caused by our broken for-profit system. So, what does that mean? Expanding Medicare would guarantee that dental, vision, and hearing are covered for the very first time. It would lower the eligibility age to cover at least 23 million additional Americans at a time when we know that a quarter of those aged 60 to 64 experience being uninsured before turning 65. And all of that would be paid for by letting Medicare negotiate directly with pharmaceutical drug companies to bring down drug prices for all Americans. That means that more is covered for more people at a lower cost. And it means lower costs for all Americans, whether they're on Medicare or not. While I'm fighting to celebrate Medicare's birthday by expanding the program, I'm also pushing to go further. Now more than ever, we need to guarantee health care for everyone as a human right. Health care with comprehensive benefits, including primary care, vision, dental, prescription drugs, mental health, long-term supports and services, reproductive care, and more. Health care without copays, private insurance premiums, deductibles, and other out-of-pocket costs. We need Medicare for All. In fact, we needed Medicare for All yesterday, when nearly 100 million people were uninsured or underinsured in the richest nation on the planet, when grandparents were sitting at the kitchen table cutting their pills in half, when parents were choosing between taking their kid to the doctor and paying rent, when you were putting off the care you needed and the care you deserved. As the leader of the Medicare for All Act in 2021 in the House of Representatives, I was proud to introduce it alongside more than half of the Democratic caucus, including more than a dozen powerful committee chairs. This landmark legislation is endorsed by over 300 local, state, and national organizations that represent nurses, doctors, unions, and racial justice organizations. Medicare has served our seniors for decades, but today, on his 56th birthday, I think it's time to take it a step further, to guarantee health care for everyone. I am so proud to be in this fight with each and every one of you. Together, we can win Medicare for All. Together, we can create a just health system. And together, we can guarantee health care as a human right, everybody in, nobody out.
Well, those were excellent videos from our fabulous pioneers and our representatives who are making the way for Medicare for All. But a little less conversation, a little more action, people. Here are some of the activists from the event that happened in D.C. I love hearing activists speak because somehow they always use words that you aren't seeing on NBC or MSNBC or really any of the BCs on corporate television. Here's a compilation video of some of the talk that went on in D.C. this past week.
I'm LaDon Love, the Executive Director of Spaces in Action, and we're coming to you live from D.C. We're between the Russell and Dirksen building. Why are we here today? Because today is Medicare's birthday. It's its anniversary. And we're here to say you're older and you're wiser and you need to expand. We need to have dental, vision, and other health insurance pieces, dental, vision, and hearing, and also making sure that Congress does not compromise on our backs. We need to make sure that health care is available to all people living in America. And let's start with Medicare. We need to take care of our most vulnerable, the folks who need health care that are eligible for Medicare right now.
I'm Arthur Blair. I want to say that Medicare anniversary is great, and with my experience with Medicare is sweet and bitter. I became disabled at a very, I'd say in some sense, a young age at 56. And here's the problem that I have experienced with Medicare. I had to wait till I was disabled, and I had to wait till I was 56 to get permanent insurance. So I want to say that I support this expansion of Medicare that is on the board now. But I want to say this is a default position for me. It's a default position because I support Medicare for All as a right in America. Because if I had gotten Medicare for All, if it was in place, it would have been a prevention measure. And if I had Medicare intervention prior to becoming disabled, there would have been some corrections made that would not have been permanent that I have to deal with today.
Health care is a right and not a privilege. And we're going to reiterate that more with our next speaker, the brother of Arthur Blair, Mr. Julian Blair.
I don't understand how a body of supposedly the smartest people in the world can't understand why dental care, vision care, and hearing should be available for everyone. I don't understand why they don't understand all the numbers that we have factually calculated shows that it's cost efficient. I don't understand that. I don't understand the need to compromise on the health of people. I just don't. So I'm here to say to Congress today that we would not be tricked in the compromise, favored tactic of Congress. We're not going to go for it. It's reasonable, it makes sense, and it's the right of all people to have decent health care. So I'm asking you, I know you are, I'm asking anyway, that we are going to drive this message home to Congress. We will not compromise. Don't even ask us to compromise. It makes no sense. We're here not only for ourselves, we're here for the right of every American, senior, middle-aged, young, whatever you identify. I identify as senior. But so we will be on your doorstep, we will be on your phone, and we will be in your face to let you know that we're here for the Medicare and medical health of all Americans. Thank you.
/rally, also in attendance at the DC rally, and it wasn't exactly a protest. It was more of a rally and a, hey, we want to expand Medicare on the anniversary of the inception of Medicare. Also in attendance was medical doctor and consultant for Social Security Works, Dr. America, who is a real doctor who just goes by Dr. America. He clearly lays out why Democrats were voted in this time in the first place, and he gives firsthand knowledge of how patients feel under this current system.
I'm Dr. Sanjeev Sriram. I'm a senior advisor at Social Security Works, and yes, in activist spaces, I am Dr. America. I'm also a Maryland primary care provider. So when I say upgrade, you say Medicare. Upgrade. Medicare. Upgrade. Medicare. Upgrade. Medicare. My patients and families need an upgrade to Medicare, and they needed it years ago. Now, many of you know that with COVID-19, we suffered serious racial disparities with this pandemic. Black and Latino people were dying at 2 to 3 times the rate, but when you look at older members of our community, ages 55 to 64, Black elders were dying at 6 times the rate of white people. Latinx people ages 55 to 64 were dying at 5 times the rate of white people. Now, there are tons of things in our society that explain these inequities, but our healthcare system is a primary problem in this injustice. If we had expanded Medicare years ago, imagine the lives we would have saved. Just imagine the number of elders who would have been here with us had we done what we were supposed to do years ago. Now, I get it. During this pandemic, we all had to survive Trump. We all had to survive Mitch McConnell. But Democrats, we put you in power to make change, not excuses. The time has come to expand Medicare. Now, when we talk about lowering that Medicare eligibility age, I want you to know what that feels like for my patients. Right now, my patients have to describe how much they earn, where they live, where they are in their employment, where they are with their education, just to get coverage, not care, coverage. Because after they get coverage, then they get copays, deductibles, all the other financial obstacle courses from the insurance companies before they can get care. With expansion of Medicare, we end the nonsense. We get people the care they deserve as a basic human right. The time has come. Let's start making changes, stop making excuses. Medicare is long overdue for negotiating on prescription drug prices. Right now, a diabetic pays about $300 a vial just for the insulin. Then there are all the other pieces that they need, the test strips, the syringes, all the other equipment they need just to stay alive. It quickly becomes a huge financial hurdle. Just to put it in more concrete terms, imagine if you were told you had to buy a PS5 for somebody else every couple of months just so you could stay alive. That is what diabetics are doing for big pharmaceutical companies every couple of months, is buying them a PS5 to stay alive. That is the ridiculousness of American healthcare. When Medicare negotiates those drug prices, we end that injustice and that insanity. Now, as a doctor, I can tell you, your eyes, your ears, and your teeth are connected to your body. I did not have to go to medical school to tell you all this, but apparently I do have to tell Congress this. Now, I know that a lot of people want to bring up the sentimental elements of covering eyeglasses and hearing aids. Wouldn't it be great for our seniors, for our elders, to be able to see and hear their spouses, their kids, their grandkids? I'm not going to rain on that sentimental parade, but I do see you, fam, if you are an older woman who is tired of seeing your husband, I get you. Maybe you don't need the eyeglasses to see him. I get it. You're done hearing your kids. You don't need the hearing aid for that. I get it. But what we need those hearing aids and eyeglasses for is for injury prevention. A slight bit of hearing loss triples your risk of falling down. Hearing aids, vision, these things are what connect us to the real world. Just a little bit of vision loss, a little bit of hearing loss, and your risk of dementia goes up by 50%. These things are not luxury items. Your teeth are not luxury items. Among our elders, Black and Latinx people suffer 2 to 3 times as many cavities as white people because we keep using racial capitalism to do dental work. We can do this. We can do this. We can make Medicare cover dental care when we start making changes and we stop making excuses. All the excuses are up. Nobody cares about that filibuster. The filibuster is for busters. Democrats, it's time to start making changes, stop making excuses. Let's expand Medicare. We are here to help you.
We're going to expand Medicare. We're going to do it. We're going to add vision, hearing, dental, and an out-of-pocket cap. And you know who hates that? Big insurance. We're going to beat them. We're going to lower the age of Medicare to 60. You know who hates that? Big hospital. And we're going to beat them. And we're going to give Medicare the ability to negotiate drug prices. And who hates that? And we're going to beat them because we've got the people. They've got the money. They're arrayed. They're probably still let in the building while we're not let in the building. They're probably allowed to carry their signs around, which we're not allowed to do. But what we are able to do is tell our elected officials that money doesn't vote, people vote. And if you compromise on our backs, it's the closest, it's the shortest path to the unemployment line for you. We are sick and tired of hearing excuses about why now is not the moment. Expanding Medicare is the compromise. This is the compromise. We've compromised as much as we will. No more compromise. We want everything. We're going to add vision. We're going to add hearing. We're going to add dental, an out-of-pocket cap. We're going to lower the age of Medicare to 60. We're going to allow Medicare to negotiate drug prices. We're going to take on the industry players, and we're going to win. Thank you so much to everybody who makes this possible. This right here contains a selection of the more than 130,000 Americans who have signed this petition to expand Medicare. We're here to deliver it. I'm going to walk it across the street into the building. I have to figure out how to get in because it's all closed right now, but I'm going to do it. We're going to make sure that our voices are heard. I also already emailed it to them so they do know, and I'm sure that all of the Capitol Police who are around are also very aware that we're here. But just in case, I ask everyone at home, do not let up. Call your senators. Tell them right now, no compromising on the people. It's time that industry, that Wall Street, that pharma, hospital, and big insurance took the loss, not the people. We're sick and tired of waiting, and we're not going to do it anymore. Thank you so much.
And who you just saw speaking was Alex Lawson, Executive Director of Social Security Works. I loved how he talked about who is standing in the way of expanding Medicare and what Social Security advocates expect to accomplish in the coming days. We're going to be able to talk to him today right here on this program in just a minute during our interview segment. So stay tuned for that.